everybody, this is Dr. Geo with this week's video introduction to week number 2 of our course in nursing research. And off to a very good start for week number 1. Week number 1, the discussion question that we tackled was this, primarily, among other things, this concept of qualitative versus quantitative research. And we had 2 studies that we looked at, the Beck post-traumatic stress study and then the Kokaba hand massage comfort study. 2 completely different studies. And they serve as a good jumping off point to talk about differences in methodology. In a nutshell, the Kokaba study was a quantitative study, and it was quantitative because it was looking for a specific cause and effect relationship. The research question for the study was, would a hand massage, a simple hand massage provided by a caregiver, increase a level of comfort or increase the comfort level in hospice patients? And that is a very straightforward goal. That's a very quantitative goal. It's looking, is there a cause and effect relationship here? That's why this was a quantitative study. A few of you have mentioned and had talked about how you felt that this could have been done as a qualitative study. And although the subject itself, talking about comfort in hospice patients, most clearly could be done as a qualitative study, but not if you're looking at cause and effect relationships. When you're trying to see if intervention A works better than intervention B, or if intervention A is effective to have a specific outcome, you must do that as a quantitative study. You cannot do that qualitatively. A qualitative study is done where the researcher, is usually done when the researcher has a research question that says, little is known about, or we have this particular group of patients or with this particular phenomenon, we really don't know much about it, we want to learn more. So it is a much more subjective and open-ended process of selecting subjects and then questioning and providing either questionnaires or focus groups or interviews with patients to get their ideas and get their thoughts on things. And there's no preconceived notion with that. It's not done with the idea that we have a hypothesis that we're going to try to support or that we know what the outcomes are going to be. We just want to talk with people and see what did they think. That's why the Beck study was a qualitative study, because that was Beck's research question here. The purpose of the study was simply to find out more about the lived experience for these women that have post-traumatic stress. It wasn't trying to prove whether they did or didn't really have post-traumatic stress. That's not the idea of the study. It wasn't trying to identify the 5 main things that cause it. All that it was trying to do was saying, what are these women going to tell us about their experiences, and then what themes can we draw from that? Usually in methodology, or methodological research, qualitative usually comes before quantitative. Usually qualitative study gives you some meat on the bone, so to speak. It kind of gives you some information to use to start with. And then after a study like this Kokaba study, the Beck study, once you have that basis of baseline of information from a qualitative study, then you can start to say, okay, what are the major causes of post-traumatic stress in these women? You can look at more cause and effect things, or what things make them feel better. Those kind of things have to be done more quantitatively, and those will come later after that qualitative process. Another concept that came up with a couple of you was the thought of a mixed method study, and would these studies be done better as a mixed method? And the short answer to that is probably yes. Particularly with the Kokaba study. The Kokaba study, the hand massage study, definitely could have been done as a mixed study. But there's a reason why she didn't do that. And the short answer for that reason is because it was just really looking for that cause-effect relationship. Does a hand massage lead to increased comfort? You don't really need mixed methods to do that. However, if the researcher wanted to say, what are some other aspects of care? I mean, maybe, what other information could we capture in this study? Then yes, a mixed methods, which is where you're doing qualitative and quantitative on the same populations essentially at the same time, that would make sense. But there's problems with a mixed method study also. It's not the panacea. It's not the end all of all studies. Not every study is done as a mixed method study. It takes more resources. It is more intrusive for patients. The patients have to, or the subjects have to do more. So it doesn't work in every particular case. And so and we'll talk about this more as we go through the class, but I wanted to point that out, that was why this particular study was not done as a mixed methods in this particular case. So that wraps up week number 1. Grading for week number 1 will be done later this week. Those discussion question grading will be done shortly. And so week number 2, jump to a new discussion question. And we're going to talk a little bit about this, the concept of primary versus secondary sources of information, and talk about what those are and what are some examples of that. And the last part of the discussion question, and kind of the meat of the discussion question this week, is to pick a nursing problem and then design a research question. And the thing that I will leave you with as you challenge with this, or as you tackle this, is remember, it's not the topic that determines the research question or the methodology. What determines the methodology for the study is the way the question's worded. If you are looking to see if intervention A works better than intervention B to affect some sort of an outcome, that is always a quantitative study. If, however, you are looking to find more about a particular topic, or you're trying to want to know something more about a particular phenomenon, or if you're focusing on the values, attitudes, and beliefs of subjects, that is done that is a qualitative study. So in other words, just because it sounds like a study is qualitative because it has to do with comfort or feelings, kind of like the Kokaba study, that doesn't necessarily mean that it's automatically going to be a qualitative study. If you are looking for a specific outcome, and if you're measuring outcomes, or if you are comparing 2 different types of interventions, then that is always a qualitative study. So I will leave you with that this week. I look forward to participating in class with you once again. Please let me know as you have any questions. I'll be more than happy to address those. I appreciate everybody's input. I appreciate the hard work that you're doing, and I look forward to participating in class with you again. So we shall see you in the discussion forums.